Peripheral neuropathy can drastically alter your quality of life. In this video, I'm going to answer the question, how bad is peripheral neuropathy, and why you should not ignore the symptoms. If foot and leg pain from peripheral neuropathy is your struggle, this will be an important video for you. Feeling lost or thinking there's no way out can be overwhelming. You might have even been told there's nothing you can do about this, you just have to live with this or deal with this. But it's not the end of the road. There is hope, and this video will share insights and encouragement to help you see that there are steps that you can take towards feeling better and functioning better. You're not in this alone. Understanding the symptoms of peripheral neuropathy can make all the differences in choosing the right therapy, managing your symptoms effectively, and preventing further nerve damage. Not only am I going to answer the question, how bad is peripheral neuropathy, I will also share with you one of the most effective neuropathy home remedy protocols designed to provide comfort and relief from the pain of peripheral neuropathy in your feet and legs. This method is safe and simple to follow. You can start using it right away to begin feeling better and reduce the pain associated with peripheral neuropathy. Watch till the end so you don't miss out on these key tips that could really help you manage and alleviate peripheral neuropathy pain in your feet and legs. Hi, I'm Dr. Ole Olson, America's neuropathy coach. For almost 20 years, I've been helping patients deal with peripheral neuropathy. I've assisted thousands of patients and taught hundreds of doctors around the country how to manage this condition gently and effectively without the use of drugs or surgery. I founded Asuta Health Neuropathy Centers, which has expanded to 5 clinics across the Midwest, specifically focused on serving and treating individuals with peripheral neuropathy. I chose the name Asuta for its meaning, to be healed, reflecting our deep commitment to healing those afflicted by this debilitating condition. Recognizing the difficulties in managing constant pain, the scarcity of widespread knowledge among healthcare providers, and the ongoing quest for effective treatments, this channel aims to bridge the gap. Our mission is clear, to offer hope and relief to everyone suffering from peripheral neuropathy. Before I dive in, I need you to hit that subscribe button below if you're looking for breakthrough methods that can significantly reduce your neuropathy pain and improve your daily quality of life. Let's embark on this journey to wellness together. I'll soon show you my 3-step remedy protocol for neuropathy. But first, let me answer this question. How bad is peripheral neuropathy? It's estimated that 25 million people in the United States are affected by peripheral neuropathy. Johns Hopkins did a study a couple of years ago showing that this number is actually much higher. They predict the number is actually closer to about 45 million people are suffering from peripheral neuropathy. This is why an accurate diagnosis is essential. Peripheral neuropathy is a progressive degenerative disease, which means if we don't have the right diagnosis, we're not doing the right things to help take care of it, and it's only going to continue to get worse. So what is peripheral neuropathy? Peripheral neuropathy is damage to the nerves outside of your brain and spinal cord. These are the nerves that simply go down our arms into our hands, down our legs into our feet, even those nerves going into our vital organs. Peripheral neuropathy has many different symptoms. Some of the most common symptoms with peripheral neuropathy are pain. It could be a burning pain, maybe even freezing cold pain. It's a sharp shooting pain. Others experience a dull, achy type pain. Yet others have no pain at all. Numbness, tingling, heavy feeling in the hands or feet is very common with people with peripheral neuropathy. Sometimes one of the most earliest signs of neuropathy is balance issues and coordination issues. Troubles buttoning your button, troubles holding on to a knife or a fork. There are many different causes when it comes to neuropathy. I want to focus on 3 main categories. The most common type of neuropathy is diabetic neuropathy. So this is people suffering with pre-diabetes or diabetes. The second most common type is chemo or radiation-induced neuropathy. So people that have gone through cancer treatments. The third most common type of neuropathy is called idiopathic. Within this category, there are over 100 different types and causes of neuropathy. Some of the ones we most commonly see are medication-induced. Things like statin drugs for cholesterol is one of the most common ones we see. Toxin exposure, so people that deal with a lot of chemicals in their work. Agent Orange exposure. Like I said, there's over 100 different types of causes within this category, and we need to figure out exactly what's going on with your individual case. When it comes down to it, there's all these different causes of neuropathy, but what I find is there's really one main cause of neuropathy. That cause is poor circulation. We find poor circulation in over 90% of the cases that we see in our clinics. As an example, think of my hand as a nerve cell. Each of these fingers are different blood vessels coming into that nerve to bring it the nourishment that it needs to survive and thrive. So it's bringing in our oxygen, it's bringing in the nutrients, all those things that nerve needs to be healthy. What happens is when we have circulation issues or blood flow issues, is those blood vessels start to shrivel. As they start to shrivel, we get less and less nutrients into that nerve cell. and eventually that nerve cell is going to end up dying off. So what we see commonly is we'll see a little more pain at some points of this disease, and we'll have more numbness and tingling at other points of the disease. So what are some common treatments associated with peripheral neuropathy? The most common treatment for peripheral neuropathy is medication. If you have any sort of pain, they're going to prescribe things like gabapentin or Lyrica. These things are actually anti-seizure, anti-anxiety medications, and they've been used as off-labeling for nerve pain. And while they may help your symptoms, remember, it's not addressing the underlying cause, which is the diabetes, the poor blood flow, things like that. That's why these things are not good long-term solutions. Another common one is oxy. We got to be very careful when we start getting into very addictive drugs like oxy. This is why we're trying to help people find solutions for this pain, so that way they can feel their best without having these dangerous drugs or surgeries. Some of the other things that people commonly use are surgeries of the spine. They'll put spinal stimulator in your back and help shock the nerve so you don't feel the pain anymore. Sometimes they'll go in and do a nerve ablation where they burn the end of the nerve, and ultimately just trying to help you with your pain, which is great. But we've got to figure out the cause. There are also many different conservative therapies out there. Supplements are a very common one people will try. There's lots of different supplements on the market, helping to reduce inflammation, increase blood flow, and really just feed and nourish the nerves. These can be good. One of the problems we typically see is that the supplement is not got a high enough dose in it, and it doesn't have a broad enough spectrum covering all the different aspects of the nutrients that are deficient in that person. Other things like light therapy have become very common. Light therapy has a ton of benefits. Low-level light therapy, I talk about that in my book, has a ton of benefits as well. Once again, there's just a lot of really cheap products coming on the market, and so you can spend a lot of money just buying these little gadgets here and there that are promising the world, when ultimately what we're missing is that comprehensive approach to care, and that's what we try to focus on in our clinics. The most important aspect is determining what is going on and what is needed for your specific type of neuropathy. Different types of neuropathies respond better to different types of therapies. Different nerve fibers respond better to different therapies. And so what we do is we've got to look at all the different factors playing into your specific condition so we can create a customized, individualized program for your therapy. Lastly, I just want to leave you with a message of hope. No matter how long you've been suffering, no matter what you've been dealing with, what you've been through, don't ever give up hope. There's something out there that'll help you not only stop the progression of this disease, but help you get back to living the life that you want, doing the things that you enjoy, whether that's spending time with your grandkids, walking your dog, or being able to sleep through the night. Don't give up. Keep trying things. Now I want to give you a simple protocol to help manage your peripheral neuropathy symptoms at home. This simple protocol, while it is not a full treatment plan, may start to give you that much needed relief of foot and leg pain. First, we're going to talk about a contrast bath. A contrast bath is where we have two different foot baths, one with warm water, one with cold water. What you're going to do is you're going to place your feet or your hands into the warm water. Now, if you have a lot of loss of sensation, have someone help you with this to make sure you don't get it too hot. We want it pretty warm, and you're going to keep your foot or hand in there for about 2 to 3 minutes. After you're done with the warm water, you're going to pull it out and immediately put your feet or hands into the cold bath. Once again, for another 1 to 2 minutes on this one. And you're just going to go back and forth 2 to 3 times on each side. What this is doing is the warm water is helping to increase the blood flow and circulation. The cold water is going to actually slow down and cause what's called vasoconstriction. So it's going to tighten up those blood vessels a little bit. It's going to shock the body a little bit, so then when we put the warm water back on, it's really going to overexpand to get more blood flow into that area. So doing this will help increase blood flow and circulation into those hands and feet. The second exercise is called calf raises or calf push-ups. With this exercise, you're going to start with your feet flat on the floor. What you're going to do is you're going to push off the ball of your foot, raising your heel up into the air. This is very easy to do while seated. Don't try to do this one standing because your calves will burn out and get fatigued. But in a seated position, you can actually get a lot of these reps in. Research has shown that by doing these, you actually increase blood flow and circulation. You also reduce the blood sugar in the bloodstream, which a lot of people with diabetic neuropathy are struggling with. With these exercises, I want you to do 50 to 100 repetitions, and you can do this 2 to 3 times a day. So we're looking for several hundred repetitions a day. Like I said, don't do this in a standing position because your calves will start to get tight and cramping up. But in a seated position without the weight of your body, you shouldn't have any issues with this. You can always start smaller and build your way up. The last exercise is the alphabet exercise. You can do this once again with your hands or your feet. So with your feet, you're going to draw out the alphabet. So A, and then B, and then C. So you're just going to walk through the alphabet. This is doing a couple of things. Once again, the movement of the foot-ankle complex or the hand and wrist is going to increase blood flow and circulation. We talked earlier how important that is for neuropathy. The second thing it's doing is in our brain, we have what's called the homunculus, which is like a map of our body. Anytime we are utilizing that body part, it's stimulating that area of the brain. And so we want to make sure the feet and hands are staying active and that area of the brain stays awake so it knows where healing needs to occur. So go through that alphabet, do that a couple of times a day as well, and that will not only help increase blood flow and circulation, but will also activate that area of the brain. I hope you found value in this video today and learned something new about peripheral neuropathy. Now I want to hear from you. What has been your experience with peripheral neuropathy? What symptoms do you get? What treatments have worked for you? What treatments have not worked for you? Comment below and let me know. If you have learned something new today about peripheral neuropathy and are begging to have hope, please like and share this video. It will help the YouTube algorithm get it out to more people who need to hear this vital information. Be sure to subscribe to my channel to get more breakthrough methods that can significantly reduce your neuropathy pain and improve your daily life. The next video you should watch is right here. You will hear from Carol, who went from suffering with lots of pain in her feet and an inability to sleep at night because of her peripheral neuropathy to now getting a full night's sleep. Go watch this video here.